Welcome to the National Emergency Response Committee on Coronavirus. This is our 74th day in coronavirus response and our 68th brief. Fellow Kenyans, thank you for joining us today for a daily update on the status of COVID-19 pandemic and our response to it. Today is day 74 since the first case of coronavirus was reported in our country. We have made tremendous progress and responses in combating the pandemic, and we want to reflect on some of our achievements as follows. To begin with, we are happy to note that when this campaign started, we only had 2 testing laboratories, and we are now glad to let Kenyans know that as of today, we have 20 such facilities across the country, strategically located in critical areas across the country, and with great reduced turnaround times from sample collection to receiving of results. And our plan is to continue to enhance this testing capacity across the country. Secondly, we have also trained a total of 11,000 healthcare workers, up to 60,000 community healthcare workers in collaboration with our different partners across 47 counties. And this number has enhanced our human resource capacity in our health facilities. And these trainings have featured on COVID-19 awareness, infection prevention, control, and how to be able to manage COVID-19 cases. We continue to receive different resources and support from different partners. We have received support for critical care. We have ventilators coming in from our development partners, and we shall continue to ensure that we have the right capacities with regards to human resources to be able to man this equipment. We have established isolation and quarantine facilities in all the counties, and we're nearly reaching a total bed capacity of over 5,000. And we shall continue to upscale our level of preparedness to ensure that Kenyans are able to get the best healthcare services. However, as we continue to combat this pandemic, we would like to remind you that we are still not in a good place. Cases continue to be recorded, and sometimes in very large numbers, and some counties have thus been identified as high-risk counties. Numbers of infection in other counties may not be considered to be high risk, however, they are still continuing to grow, and therefore we need to enhance our alert, and this should be a concern for all of us. The containment measures that we have repeatedly mentioned, and again we shall emphasize today, include hand washing with soap, maintaining of social and physical distance, proper wearing of masks when in public spaces, and to stay at home when possible. Additional measures have been given over time, including the national curfew, cessation of movement in and out of Nairobi, Mombasa, Mandera, Kilifi, Kwale counties, restriction of movements in high cluster areas like Eastleigh and Old Town in Mombasa. And all these measures, we are all aware, fellow Kenyans, have made life not only uncomfortable, but also difficult. However, we do maintain that these measures are necessary for us to be able to effectively deal with this pandemic. And compliance with these measures has significantly contributed to what our COVID-19 curve looks like today. The situation could be different if we had not advocated and adhered to these measures. We would like to thank Kenyans in general for their support and patriotism in observing these measures, despite the inconvenience that they have had to endure. And I would like to urge each and every one of us to continue rendering support to this fight, because that is how we shall defeat this virus. With regard to our COVID-19 situation today, our infections are yet to stabilize. Today, we have 72 individuals testing positive for the virus from 2,711 samples tested. The cumulative caseload of positives in the country therefore stands at 1,286, while a total sample of samples tested so far stand at 61,971. Of the 72 individuals, 70 of the cases are Kenyans, whereas one is of Somali nationality and the other is Ugandan. Of the positive cases, 44 are male, whereas 28 are female. The age range is between 12 years to the youngest and 78 years for the oldest. The positive cases are spread across the following counties. In Nairobi, we have 52 cases. Mombasa, 11, Kiambu, 7, Isiolo, 1, Turkana, 1. And Turkana now becomes the latest county to record a case. And this brings to total the number of counties that have reported a COVID-19 case to 29. In terms of breakdown by sub-county, in Nairobi, the cases are distributed as follows. Lang'ata has 21 cases, Dagoretti North 15, Kamukunji and Kibra 4 cases each, Embakasi East 2, Kasarani 3, Dagoretti South 1, Makadara and Mathare 1 case each. In Mombasa, 4 are from Nyali, 3 Mvita, 3 Kisauni and 1 Changamwe. The 7 cases in Kiambu are from Limuru 2, 1 case Githunguri, Kabete, Ruiru, Thika and Kikuyu all have 1 case, and 1 case from Isiolo has been identified, and that case is in mandatory quarantine, whereas in Turkana we have 1 case from Kakuma. Today we are happy to inform you that we've discharged another 9 patients who've recovered from the disease, bringing a total of recoveries to 402. And we continue to sincerely be indebted and to thank our healthcare workers for their continued dedication and hard work in ensuring the full recovery of these individuals. However, on a sad note, we now have a total fatality of 52. We lost 1 more patient to the disease, and we do condole with their families and friends and those who've lost their loved ones in this pandemic. During this time of COVID-19, we would like to emphasize 1 more measure that we find to be very important, and that is that of maintaining a healthy diet, because it strengthens our body's immune system to be able to fight diseases. And it's important to note specifically for individuals who may have underlying conditions or who may have issues such as malnourishment are at greater risk of various infections, including this of COVID-19. We'd also like to emphasize that it is important that we do pay great attention to what we eat. And in this regard, the Ministry of Health has developed several nutrition guidelines in response to COVID-19. And these guidelines are all available in the ministry's website. And the emphasis really, Kenyans, is to maintain a healthy diet, a balanced healthy diet, and to ensure also that you do put in place exercise. And we've noticed that these do go a long way in improving immunity and helping to fight against COVID-19. And finally, I would like to join all Africans across the continent who are celebrating Africa Day today, a day that has been set aside by the African Union to celebrate peace and prosperity in Africa. And this year's focus continues to be a joint effort through this continent to combat COVID-19. Thank you.
Chance to ask questions, but to keep on saying, please keep them short, so that you can give your colleagues the chance to also ask questions. Remember your name.
My name is Bernardine Mutanu. I am a reporter with the Daily Nation. My question... Okay. My name is Bernardine Mutanu. I'm a reporter with the Daily Nation. I have 2 questions. One is about the truckers at the Kenya-Uganda border. I don't know whether the government has been listing the positive 19 cases in our daily briefings, or I don't know what has been happening. If it has been listing, if it has been including them, for how long has it been doing that? Then the second question is about the tracing. How long does it take for a contact to be traced?
Okay, I'm Haimba from Ebru TV. Was there maybe the cases for Lang'ata? I don't know. How did you actually identify all these cases? Because for the Nairobi County, it is Lang'ata that has actually posted the highest number of the confirmed cases. Then maybe just a quick one, maybe I don't know whether it is direct to Daktari Amoth. By the time the country began producing its own face mask and other PPEs, ventilators, initially there was a high cost of actually treating COVID-19. I don't know, by the time the country began producing its own all these facilities, has the cost of treating COVID-19 gone down, or it is still, because initially it was suggested, it was actually hinted that it was about 1 million per patient. How much currently is the cost of treating a COVID-19 patient?
Purity Museo, KBC.
there is a vaccine that has been okayed by the EU and the United States, and also today the researchers at Kemri, Kilifi County, hinted at having an antibody test that will help in tracing or helping the government, especially in the contact testing, tracing the people who could be carrying the virus. Do we have such discussions ongoing?
Okay. My question is, how many medics have Stacy Kirori from NTV, Gena Kirori, NTV. How many medics have so far contracted the virus, and is this attributed to the substandard PPEs? My second question is, to what extent has COVID-19 affected maternal and child care health? And lastly, how is the government ascertaining the quality of the food donations being given to different counties? Thank you.
Yes. Could you repeat your first question?
Okay. My first question is, how many medics have so far contracted the virus, and some of the cases attributed to the substandard PPEs that some medics have been complaining about? The second question is, to what extent has COVID-19 affected maternal and child care in different areas? And lastly, how is the government ascertaining the quality of the food donations being given in different counties? Thank you.
Right. Thank you. Thank you for your questions. And I'll begin with the last set of questions regarding one, the PPEs. And I think this has been emphasized previously numerous times by our Cabinet Secretary. The PPEs that are being availed for our healthcare workers are PPEs that have undergone a stringent regulatory process within our country, ensuring, one, the participation of medics led by the DG here in ensuring that these PPEs are safe and that they actually protect them, and two, also undergoing stringent tests in terms of ensuring that they are actually able to protect them in conjunction with the Ministry of Trade and with KEBS and our Pharmacy and Poisons Board. And so we do stand by the PPEs that we distribute as government to ensure that these are actually safe for our healthcare workers. Concerning the effects of COVID-19 with regards to maternal and child healthcare services, it's important to note that COVID-19 has brought with it both detrimental effects and also sometimes what we'd call a silver lining in terms of our responses when it comes to diseases. I think this has again been emphasized in past press conferences where the DG has actually shared, and today he'll re-emphasize on the effects on maternal care. Yes, we do have fewer mothers actually coming into health facilities, and usually as a country we do have statisticians who work with us and are able to model for us the expected number of deliveries every day in this country annually. And so we do have projections of how many mothers we'd be expecting to see in our healthcare facilities. When we compare these numbers as at this quarter with how we were last quarter, we are seeing that there's a drop in health-seeking behavior. Some Kenyans are seeking health services, less than they were before, and we do have a team that's trying to review, one, what are the reasons as to why they're seeking, healthcare services not as much as they were before, but two, also putting in place measures to actually encourage Kenyans to come to hospitals. When you are unwell and you need care from a doctor, do not be afraid, come to the hospital. You will not get your COVID-19 in the hospital because we've put measures in place to protect, one, the healthcare worker, but also to protect yourself as you seek those healthcare services. And it's important to note that this stretches on beyond maternal care, to HIV care, to patients who require dialysis, to patients who require different procedures on a regular routine basis from our health facilities. So we're encouraging Kenyans to continue coming forward. In the coming days, perhaps we'll share with you a more disaggregated statistical report in terms of healthcare seeking behavior in the country. You've mentioned the issue of food safety. Again, this is a joint effort, a joint interministerial effort, and I'll be asking Dr. Kefa, who is here today, to share with us more information as to how we undertake our regulatory processes when it comes to food safety. There's an issue from Purity Museo regarding our vaccines that have undergone a first phase of approval in the EU and United States. In fact, to this point, I'm well aware of about 21 vaccine initiatives across the country, across the world, that are undergoing. And yes, indeed, this one has gotten approval from the EU and the US, but it's still undergoing a phase by the time it can actually be administered in terms of the human population. When we look back at what we're doing in Kenya, the DG has emphasized previously previously that Kenya is part of the countries that are undertaking the WHO drug trial. And with regards to vaccines, we are yet to start any vaccine initiative. However, again, it's important to remember that vaccine trials do not just start, haphazardly. There are actually mechanisms through which institutions that are participating in vaccine trials would undergo to get approval. However, again, we do commend KEMRI Wellcome Trust. I'm well aware that they have actually developed an immunoassay that they are going to utilize for antibody testing. And this is part of the seroprevalence surveys that we mentioned before. Being able to look within the community and undertake antibody testing to determine what is the prevalence of COVID-19. In other words, patients who may have encountered COVID-19 are now well, but they have these IgG antibodies in their immune systems. So this is a process that's undergoing through KEMRI Wellcome Trust, and it's a process that will undergo the needed rigorous regulatory mechanisms that need to be undertaken for such a trial to proceed. Again, different countries are looking to put in place different measures. Different antibody tests are under development, but as the Cabinet Secretary has insisted, and this is the position of the Ministry of Health, we're very careful on what tests shall be administered, because we must ensure that these tests are actually able to be specific and sensitive in terms of their utility in Kenya. With regards to PPEs, it's important to note, yes, this has been a huge cost driver, Kaemba, when it comes to the fight against COVID-19, not only in Kenya but across the world. And again, the DG will be able to share with you what it takes to be able to actually attend to one COVID-19 patient. How many, healthcare workers are attributed to one patient? How many times those healthcare workers will be able to change their PPEs, because sometimes they might have to do 4 shifts in one day. And so the cost of PPEs remain to be, a challenge for us. But then again, we've made headway. And I must say, from the beginning of the response to the 74th day of the response, we've really made a lot of headway. We now have local manufacturing of PPEs, and indeed, this has brought down the cost. And in coming days, we'll be able to share with you an aggregate value of what it would have been like if we did not have our local manufacturers contributing into this fight. The other issue that was asked was from Bernardine from Daily Nation regarding the trackers between Kenya and Uganda. Again, an issue that has come to our attention. In fact, today during the NERC meeting that just concluded, this issue was discussed, and we were informed that tomorrow there will be a meeting between the EAC state ministers, and they'll be discussing as to how we can improve the situation at the border. However, it's important to note that what we're trying to put in place are mechanisms that ensure the safety of all citizens in all the EAC countries, while still ensuring that trade continues. And so tomorrow there'll be a more comprehensive report and statement from all the EAC ministers on how we will deal with this issue going forward. I'd like to invite the DG perhaps to jump in and elaborate on the issue of vaccines, as well as the Langata case. DG, thank you.
Thank you, Madam CS. I think you have articulated the issue of the vaccines very clearly, that there is a process in terms of development of vaccines. One thing that you look for is safety, then followed by efficacy. Safety is that you try it first in the animal models to see what happens to the animals. And then in terms of efficacy, that is when you try to see what dosage is to be administered, and of course then you monitor the side effects. And if you are to go into a vaccine trial, there is a clear set parameters that we need to follow. And if Kenya is chosen as part of that vaccine trial, then all those parameters will have to be followed to the letter. Regarding the PPEs, I want to applaud the Kenyan manufacturers for coming into this space quickly to be able to start local manufacturing of PPEs. As a result of that, the cost has drastically dropped. From the imported full kit PPE we used to procure at about 12,500. Locally manufactured PPE from Nakuru, Bedi, or the company in Athi River is slightly less than 5,000. So you can look at that figure and calculate how much you are able to save. And we assure you, and the health workers are assured fully, that these locally made PPEs meet the criteria of KEBS, and we also have an input into their acceptance into the system. And thus far we have not had any challenge. The trackers, you remember we started the testing of trackers way back 2 or 3 weeks ago, and you remember we even had an issue with our neighbors in Tanzania at Namanga. And based on that, we have tried to work very closely with the Ministry of Transport, Ministry of Trade, Ministry of EAC to be able to facilitate seamless and smooth cargo movement between the EAC countries. However, because we have not come up with a cohesive plan as an EAC, as the East African community, you find that one country has been able to put this particular measure in place. That is what is leading to our problems. But even today, there's a team of PSS who are at Malaba to be able to address these issues. And basically, because we have agreed that all of us are going to test, it's just a question of operations to be able to ease that backlog. Regarding maternal newborn health services in view of COVID, yes, as Madam CAS has clearly articulated, these services have been affected. But the effect is just because of fear and lack of correct information and stigma. But we want to assure the public and you media people as custodians of the people's information to be able to inform Kenyan people that our hospitals are safe, our health care workers are well trained, we have enough protective gear, so they should still come to the facilities. Remember, if a mother fails to take a child for vaccination, for example, against polio, we are on track to be able to eradicate polio. So if one or two mothers fail to be able to take their kids for polio, then it means we cannot be able to reach our target. And that not only puts Kenya at a risk, but the entire African continent and the entire globe. So it's important that we work together as Kenyan people, civil society, church leaders, political leaders, to continue to hammer this message that our healthcare facilities are safe, our healthcare workers are well trained, they have sufficient quantities of high quality gear to be able to protect you. So nobody should shy away from going to a health facility to get services. Then in terms of contact tracing, as soon as we get the results within about 1 or 2 hours, we are able to communicate to those who test positive for COVID-19. And where we get extreme support from the people who test positive, contact tracing is very, very easy because he or she will be able to tell you, I come from this particular locality, this is where I live, and it's just a phone call away to be able to to trace the first contact. However, some Kenyans have become crafty and they give us false information in terms of their mobile numbers. So we test, the test comes out positive, but when you call, then it's a different person. Then that makes it very, very difficult for us. I want to assure Kenyans once again that the diagnosis of COVID is not a death sentence. Please support the healthcare workers to ensure that we are able to do contact tracing and we protect the rest of your family and other Kenyans. How did we identify the cases in Langata? Of course, we have our surveillance system in place. Based on the cases that we have received and have tested positive, then we go to those particular localities to be able to trace people related to the index cases. Of course, there are also Kenyans of goodwill who come out in their numbers to go for in the targeted testing, who just offer themselves to be able to be tested. That is how we identify people. The cost, of course, has come down significantly because of local manufacture of PPEs. I think the cost has come down by more than 50%. And this is the beauty of this, that going forward, we are looking at even a possibility of Kenyan local manufacturers manufacturing PPEs, not only for the EAC region, that is Uganda, Rwanda, South Sudan, but also the other countries like DRC, Ethiopia, and the like. So, as we have always said, behind every dark cloud there's a silver lining. The antibody test, yes, very critical for seroprevalence at community level. However, as at now, our gold standard is the real-time PCR as recommended by WHO. But because Kemli Wellcome Trust is a research institution, it would be good for them to go ahead with the development of this antibody-based test for us to be able to carry out research to see the prevalence of the virus in our public, in the population. But that notwithstanding, I've articulated here before the pitfalls of the antibody tests. One, of course, is that antibodies tend to be produced much later, probably 12 to 14 days after infection, in which case you lose an opportunity to be able to quarantine people, to be able to isolate, and therefore further stop transmission. Number two, the coronavirus belongs to a group of other beta coronaviruses, and sometimes there's lack of specificity, that you can have the coronavirus that causes just a mild flu, but the antibody test will interpret it like COVID-19, which is a more serious disease. Then number three is that those who have chronic illnesses like HIV, TB, or you have severe malnutrition or cancer, may not mount a sufficient immune response. So they'll produce little or no detected antibodies. Therefore, you may test them with the antibody test, and it will come out negative. Not that they don't have COVID, but it's just because that their immune response is not sufficient. So that is what we call a false positive. You have the disease, but the test does not pick it. But clearly it is an important tool for research, because we have to look at this going forward in the foreseeable future, that COVID is going to be here with us to stay. So we need to develop tools and applications that will be able to make us reach a bigger proportion of the population. So I want to thank Kenyans again for the support they have accorded us. When we even opened the restaurants, you have seen the numbers have not had a surge. And even as we plan to open the economy further, I believe that Kenyans will work together holding our hands, literally holding our hands, to ensure that we don't have a second peak or a resurgence in terms of the numbers once we open the economy further. Thank you.
On the number of medics who have actually contracted.
Thank you. 34 have tested positive. Not all the 34 have tested positive because of their nature of work. I know of one who tested positive because he visited a friend at Fandia Hospital in Mombasa who was positive. So as at 2 or 3 weeks ago, 5.5% of the healthcare workers are tested positive. But because our numbers are more than 1,200, I think that figure will come to about 1.something%. So that alone also tells you that our capacity building is working. The healthcare workers are applying what they have been taught in terms of infection prevention control, and also we can vouch for the quality of the PPEs that we use. Thank you.
There was one more question on food safety. Could we have a microphone for Kefa? Is there any extra microphone, or we'll just switch it? Kefa, I might have to translate for you.
Okay. Thanks, Cass, Madam Cass. On issues of food safety, just like you have said, food is a very critical component of management of COVID. And indeed, the government is aware that there will be need for more food for the population. And in line with that, there is a standing committee in place, which is actually listed in the Ministry of Agriculture, where we are also participating, which is addressing issues of food safety and food security. As you are all aware, we subscribe to the international standards, the East African standards, and the local standards. And you're also aware that the critical arms which deal with the issues that are very critical for human survival are still operating. That's KEBS, the ministry, and all foods that are coming in are being subjected to those standards, including those who are actually also donating the food. You are aware that there is a protocol which addresses how food should be able to move from somebody who's donating to those people who are receiving, arising from the challenges which we were seeing earlier. And one of the critical requirements is that that food must be subjected to some test so that the food is safe for the consumption of the people. Thank you.
Thank you, Kefa, for that. And perhaps as we conclude, one more thing, I'd like to thank members of the Fourth Estate for celebrating our Director General here. He's being very modest and humble today, but allow me and perhaps join me in actually giving him a round of applause, because he is now the Vice Chairman of the Executive Board of the World Health Assembly, WHO, and perhaps for Kenyans to understand, DG, what your role will entail and how this raises and, elevates the Kenyan flag, and how perhaps even our issues in terms of health will be better articulated at the apex body that governs health globally. DG.
Thank you, Madam CS. On Monday and Tuesday, the World Health Assembly had a virtual meeting, and then on Friday we had a meeting of the executive board of the WHO. The executive board is made up of 34 health professionals whose function is basically one is to implement the policies and decisions made by the World Health Assembly. Number two, our role will be to be able to advise the World Health Assembly in its operations. And number three is to facilitate the work of the World Health Assembly. Usually this board meets twice in a year, a meeting that takes place in January, and another one that happens in May after the completion of the World Health Assembly. We work through a committee called the Program Budget and Administration. So our team would be responsible for budgeting for the entire globe in terms of what WHO requires to implement to be able to safeguard the health of the global population. We are 5 members from the African continent, that is Kenya, Botswana, Ghana, Gabon, Guinea-Bissau, and Madagascar. Then there are others from the other WHO regional offices. So my role would be basically to articulate the issues that are pertinent to Kenya, to the East African region, the African continent, to ensure that we are felt at that global arena, even post-COVID. Remember, as an African continent, we face the triple burden of disease. We have the communicable diseases to contend with, the non-communicable diseases, the cancers that are up and about, disturbing our health systems, and of course the epidemics and the pandemics that, like what we are dealing with. So it is my role and the other 4 vice representatives from Africa to be able to put the requests or the priorities of Africa in that global agenda so that we are not left behind. And I assure you we'll do that work with utmost diligence through your support. Thank you.